Preparing your child to go to a medical appointment is very important. The first thing that we always tell parents is that you should prepare your child for an arrival to a medical appointment, which means to be honest. Now, you don't necessarily have to tell them many days in advance, but I think it is important maybe the day of, maybe the morning before you go to an afternoon appointment, you might tell them that you're going to the doctor and that you should be honest about what the doctor appointment is for. This, of course, is sensitive to age, developmental considerations, 3 or 4-year-olds versus a 12 school-age-year-old child or a teenager. So you have to take these developmental considerations into account. But basically, being honest with your child is very important. Often, the scientists will talk about how parents may not tell a whole truth to their child. It's not necessarily a lie, but they may not tell them the whole story. And then kids feel that you tricked them, and they feel like you weren't honest with them. And that will sometimes make their pain or their distress or their anxiety a lot higher. So it's important to be honest with your child about why they're going to the doctor, and that you're going to be with them, and that you're going to provide comfort, and that you'll be in the room with them or in the doctor's exam or whatever it is that, again, helps your child to feel comfortable. Now, some younger children like to bring their blanket or their stuffed animal, or they want to bring their iPad or whatever it is that's important to them, and I would just highlight that if there are items that help your child to feel more comfortable, you should absolutely bring those items along so that the child has some sort of comfort blanket or toy or activity that they're engaged in and that they'll find enjoyable while they're at the doctor's office. Sometimes you wait in the doctor's office, for a half hour or an hour to be seen. So again, you don't want that to be what we call anticipatory anxiety, where the child's really anxious and it's getting more and more ramped up as time goes along. So again, to have these items with them would be important. Sometimes they like to have their siblings with them if that's possible. Again, sometimes the mother or the father or the aunt or the grandmother or whomever is the primary caretaker is there providing comfort for them. And being able to be an advocate for your child in the office is important with your medical doctor or the nurse or whomever you're meeting with, so that they feel comfortable and at ease, and that you're taking care of your child's needs as their advocate and making sure that you're communicating with them and also with the medical professional. So going to an office visit, while it might seem like it's not that big of a deal for us as an adult, I think for children it's something we have to take into consideration so that we can help them to feel more comfortable to come to these doctor's appointments that they need to attend, but in a comfortable and less anxiety-provoking manner.